In the depths of scientific exploration, a shadowy enigma lurks, waiting to entangle our minds in its web of intrigue. Imagine a puzzle so perplexing, it defies the boundaries of reason and plunges us into the darkest recesses of human fascination. Today, dear viewers, we embark on a spine-tingling journey into the heart of a mystery that has baffled the medical world for ages. But beware, for what lies ahead is a tale of hair-raising horror and unfathomable fascination. Prepare to be spellbound as we unveil the eerie secrets of the Rapunzel hair syndrome. This is a narrative that will haunt your thoughts long after the screen fades to black. Welcome to the enigmatic abyss of the Rapunzel hair syndrome. Now, let's unveil a tale that will grip your imagination and haunt your thoughts, a tale that begins with the Rapunzel hair syndrome. Named after the long-haired maiden of the Grimm brothers' fable, this enigma first emerged in the annals of medical literature in 1968, described by Vaughan and his team. The name was aptly chosen, as it perfectly captures the essence of both the fairy tale and the clinical cases that would follow. But what is this mysterious syndrome, and how does it weave its spell over those who encounter it? For centuries, bezoars, undigested masses found in the stomachs of humans and animals, were an oddity. Yet, as we tamper more with our gastrointestinal tracts, such discoveries have become unsettlingly frequent. In 2007, a literature review unearthed just 27 documented cases of Rapunzel syndrome between 1968 and 2006, solidifying its status as a rarity. But this enigma persists, with a few scattered reports published beyond that time frame. The Rapunzel syndrome takes on various forms, but at its core, it involves a gastric trichobezoar formed by hair, with a tail that extends beyond the duodenum, as observed in the case before us. Its origin lies in the compulsion of individuals to pull out their hair and ingest it, a duo of disorders known as Trichotillomania and Trichophagia. This condition is not limited to those with psychiatric disorders. It can affect young girls from various walks of life. Now, let's delve into our first case, a 22-year-old woman who found herself on a nightmarish path. Her life took a sinister turn with 3 months of relentless vomiting and agonizing epigastric pain. An upper digestive tract endoscopy revealed a nightmarish sight, a tumor formed by strands of black hair, entwined in her stomach, obscuring the view of the pylorus. But the horror didn't end there. Her mother held a secret, a hair-pulling habit concealed by clandestine consumption. Admitted to the hospital, she faced not only surgical treatment but also a haunting psychiatric evaluation. The enigma deepened as a second endoscopy exposed a grotesque sight, a massive, blackened mass of hair, fibrin, and food residue in her stomach. The computed tomography scan revealed even more, with hypodense areas in the small bowel and a menacing bowel intussusception. Surgical intervention was inescapable. The surgical team embarked on a nightmarish odyssey, initially opting for video laparoscopy but ultimately resorting to laparotomy due to the enormity of the trichobezoar. What they uncovered was beyond imagination, a hairball spanning 1.6 meters, traversing the stomach, duodenum, and even the small intestine. Further horror awaited them, a trichobezoar, 2 centimeters in diameter, extended into the ascending colon. Yet, against all odds, the patient's recovery was uneventful, and she was released from the hospital. Our journey into the shadowy realm of the Rapunzel hair syndrome takes us to a chilling encounter with a 13-year-old girl, a victim of this peculiar affliction. She arrived at the hospital burdened by abdominal pain, persistent nausea, and an incessant urge to vomit. Her condition had been tormenting her for 5 agonizing months, with the last month marked by bouts of nausea and relentless retching. A physical examination unveiled epigastric tenderness and a sinister presence, a hard, well-defined mass with unnervingly smooth margins. Surprisingly, aside from these ominous signs, her laboratory results displayed no abnormalities, save for one unsettling detail: iron deficiency anemia, hinting at a deeper, concealed darkness. A gastroscopy, conducted under anesthesia, was the key to unraveling this enigma. It revealed a stomach devoured by a Trichobezoar, an indigestible mass formed by hair that filled every nook and cranny. Yet, this revelation was but the tip of the iceberg, for a deeper and more sinister truth was soon to be uncovered. In the interview that followed, a sinister narrative emerged. For nearly 10 months, this young soul had been feeding on her own hair, a habit that defied reason and plunged her into the abyss of the Rapunzel hair syndrome. The psychiatric department was promptly consulted, leading to a diagnosis of Trichotillomania, entwined with an anxiety disorder. As a vital piece of the puzzle fell into place, a delicate decision was made to commence treatment, not through immediate surgery, but through psychological and medical support. The operation was postponed for 3 weeks as this young girl embarked on a journey to confront her inner demons. 3 weeks later, when her clinical condition had stabilized, the surgical intervention finally took place. The operation was a chilling endeavor as a 23 by 8 centimeters bezoar, a nightmarish accumulation of hair, was meticulously extracted through a gastrostomy incision on the anterior surface of the gastric corpus. Remarkably, there were no postoperative complications, and the patient's departure from the hospital was a relief. The advice of the psychiatry department echoed in her ears as she ventured back into the world, carrying with her not only the physical scars of her ordeal, but also the psychological strength to confront the shadows that had plagued her existence. In this chilling case, the Trichobezoar, a dark entity that had once ensnared her, was vanquished. Unlike some cases we may encounter, this one offers a glimmer of hope, a testament to the importance of addressing the psychological underpinnings of the Rapunzel hair syndrome. It teaches us that in the darkest of tales, a sliver of light can guide us towards recovery. And so, we conclude our second encounter with the Rapunzel hair syndrome, a haunting chapter in the annals of medical mysteries that reminds us of the intricate interplay between body and mind, and the resilience of the human spirit in the face of darkness. As we close the chapters on these harrowing tales, remember that the Rapunzel hair syndrome isn't just a medical anomaly, it's a chilling reminder of the tangled webs our minds can weave. But fear not, for the quest to unravel such mysteries continues. If you're someone who's drawn to the enigmatic and yearns for knowledge, then make sure to hit that subscribe button and join our Bizarre Enigma Stories community. By subscribing, you'll ensure that you're always in the loop for our latest mind-boggling tales. Together, we'll continue our quest to unravel the secrets that lie just beyond our comprehension.